Dental Students Association, AXA, and I'm also a member for a Youth Health Working Group in Civil Life Association, which has echoes of consultancy to the UN. I'm youth health advocate working closely with young refugees, and I'll be moderating today's discussion along with my young, dynamic colleague, Amit. Floor is yours, Amit.
Hi everyone, welcome to this breakout session. I'm very happy to meet you all, and I'm very much looking forward to this fruitful discussion. My name is Amit Timilsina. I am from Nepal, and currently I'm working as Vice Chair for Youth Coalition for Sexual and Reproductive Rights, and I'm also a member of Evidence and Knowledge Working Group, which is the body of the PMNCH World Health Organization, and I'm also a member of Asia Pacific Alliance for Sexual and Reproductive Rights. Thank you.
Thank you, Amit. Well, I'm seeing in the chat box that we have a diverse group from different countries and organizations, and we have as well as sexual reproductive health specialists, I guess. So I'm really happy and excited to be holding this session with you all. And we have, I think, Dr. Iftiar from CARE from Bangladesh, and if he will be co-facilitating our um, our breakout session. And if he would you like to introduce yourself, Dr. Iftiar? Oh, he might be having some internet connection problems. So yeah, maybe he joins later and introduces himself. And now I would like to begin the conversation with my uh, colleague Amit by asking you two general questions, actually very close to the ones that you've been asked in the plenary. Um, first question, my first question is, what do you think are the issues facing adolescents and youth in humanitarian settings regarding their sexual and reproductive health? You could either type in the chat box or answer them uh, by speaking, by turning your microphone on. So does anybody want to provide input for this question and tell what the main issues facing adolescents and youth in terms of sexual reproductive health? Maybe we can start with Amit. Amit, I wonder your input regarding this. Would you like to share your experiences?
Yeah, thank you so much. We experienced similar humanitarian crisis situation back in Nepal in 2015, like when we had like massive earthquake. And at that time as well, like I can remember uh, the sexual and reproductive health and rights of adolescents were did go like unnoticed during that period of time as well. And there was like very less advocacy around sexual and reproductive health and rights of young people. And apart from that, the health of apart from the health, also like the education was also like very much affected during that period of time. And policymaker and service provider paid little attention during that situation. Later, only to like respond to their needs. So I think there are lots of like issues that adolescents face, especially particularly regarding their sexual and reproductive health. But I think we have very amazing pool of people here who have a lot of experience and things to say. So maybe like we can also discuss with our participant.
Yes, I was just checking in the chat box to see interventions from our participants. Well, there are not any, but we want you to write your input in the chat box We're expecting your own perspectives and your own experiences. Because I see there are people from UNFPA, CARE, and so many other valuable organizations as well. So please do not hesitate to write anything in the chat box or even opening your microphone and speak to us. Thank you all. Um, so Amit, what you said is really great examples of the common problems facing adolescents in the in terms of the sexual reproductive health. So thank you for your input. I would like to share some things as well. To speak from my own experiences, it's likely that youth and adolescents face a lot of problems regarding their sexual and reproductive health, especially in humanitarian emergencies. So I live in Turkey, very close to the Syrian border, and working with young Syrian refugees in my organization. Therefore, I witnessed issues such as sexual violence, increased transmission of HIV and other sexually transmitted infections, no health services available, unintended pregnancies, increased number of morbidity and mortality both in the general population and among maternal and newborns as well. So also there were a lot of cultural stigmas and taboos around sexual and reproductive health. I'm saying that there are many inputs coming along. So Lucy said unplanned and high risk of pregnancies for adults and girls. That is more than correct. Exactly. And Mashjiban Kazi said uh, many people to go to hospitals for medical facilitators have a severe impact. Yeah, as per UNFPA assessment on the impact of COVID-19, both from lockdown conditions and hesitancy of many people to go to hospitals or medical facilitators, have a severe impact on sexual reproductive health, family planning, and protection services for women, according to UNFPA analysis. A 10% decline in service coverage of essential maternal care may result in 1,300 103,000 additional births without access to health facilities, leading to 1,086 additional maternal deaths and 30,000 additional stillbirths, with a decline of 20% in women protection services. 1 in 6 million additional women will face increased risk of violence. Wow, this is from UNFPA Pakistan. Well, actually, thank you for this evidence-based intervention, um, Majid, Mahjabin. I mean, this is really good way to see how how the situation is formed with the impact of COVID-19 and how will COVID-19 have a long-lasting effect on adults and sexual reproductive health. So
Yeah, and
these are
also Lucy has also like expressed here that unplanned and high risk pregnancies for adolescent girls are also like the few of problems that adolescents face during this humanitarian crisis situation. So yeah, anybody wants to share like anything on this? If they want to speak up, I think they can do it now.
Uh, may I come in?
Yeah, please go ahead, Raza.
Thank you. This is Raza from Afghanistan. Actually, I wanted to share with you like the current context in Afghanistan, that how the adolescents are facing with problems. The first issue is the knowledge and information about the SRH rights. And also the barriers, how they have, what are the barriers that they are having to have access to the SRH services, and also the knowledge and information of the health workers. So this is the first step that whenever we do analysis, so that is the first step that we should consider in the planning purposes for the provision of the SRH services to the adolescents. Sexuality education, that is also the obstacles for the adolescents, that they do not have it and there are no resources that they can get information, neither from the schools, not from the health facilities. Those are the things. In addition to that, as a fragile country or situations, in also the geographical access problems, these are additional obstacle for accessing in such kind of the problem, such kind of the services. Uh, UNFPA is working with other partners how to make those services and also the information accessible to the adolescents. So there are multiple programs in initiatives in Afghanistan. One of them is like through the youth health line. So that is one of the possibility that the youth and also the adolescents can have access to informations about their SRH and also their health problems, particularly the SRH problems. They call there, they get informations, and whenever required, so they are referred to the next level of the informations. So in general, I will conclude that one, that the access to the information and also to the services is a problem apart from other geographical obstacles and also the security concerns that the country have it. So thank you for that.
Thank you, Raza, for your amazing narration. I mean, that was a good perspective from a field worker like you are. Thank you. I think we shall move to the next slide now. Yeah, perfect. So we'll be talking about the chapter 4 of the Adolescent Sexual Reproductive Health Toolkit today. Chapter 4 is Priority Adolescent Sexual and Reproductive Health Activities in Emergency Settings. So it's very linked with Adolescent Inclusive Minimal Initial Service Package, which has the abbreviation of MISP. So you'll be hearing this a lot. Please get used to MISP. Chapter 4 provides guidance on how to implement Adolescent Inclusive Minimal Initial Service Package, which is again MISP. And MISP outlines the critical sexual and reproductive health activities that humanitarians should prioritize in emergency settings to address adolescents' unique needs. These activities should be implemented from the onset of an emergency through the recovery phase. So, MISP is a chapter of Interagency Field Manual on Reproductive Health in Humanitarian Settings. So this IAFM is like as a target group, it's about sexual reproductive health, but not specifically focuses on adolescents. But MISP is very essential both for the general sexual reproductive health and adolescents sexual reproductive health in humanitarian settings. And there are 6 main objectives of MISP, and I call these 6 objectives as life-saving objectives. And I would like to ask you if you know any of 6 objectives of MISP. Can you please type it in the chat box or say it louder any of the, if you have any idea about what the 6 objectives of this can be. Does anybody want to provide input for this question? Well, I think there's not input for now. Well, as you can read on the slide, this code, we believe that if MISP is implemented just from the onset of an emergency crisis, it would prevent mortality, morbidity, and disability in crisis-affected populations by preventing and responding to sexual violence, reducing HIV transmission, and preventing unintended pregnancies, and transitioning to more comprehensive SRH services that will be available. So yeah, we have one objective coming from Majid Kazi. The objective 1, ensure health sector cluster. Yes, exactly. This is the first objective of MISP. So I would like to share with you all of the 6 objectives as Mahjaban is doing in the chat box. So thank you, Mahjaban, for writing them down. So quickly, if you want to hear what the 6 objectives are, the first one is ensuring the health sector identifying themselves as a lead as the lead of the implementation of the MISP. And the second one is preventing sexual violence and responding to the needs of sexual violence with survivors. And the third one is preventing the transmission of the sexually transmitted infections like HIV and other infections. And the fourth objective is preventing excess maternal and newborn morbidity and mortalities. And the fifth one is preventing unintended pregnancies. So, and the last one is planning for comprehensive SRH services and integrated into primary healthcare as soon as possible, including the community health workers and other partners and stakeholders of the health sector. So yeah, if you want to see them written, Majaban did it for us. You can read them as well from the chat box. So we really believe that when Chapter 4 is implemented from an onset of a crisis, it really is able to save lives and prevent illnesses, especially among young women and girls. Yes. Actually, what MISP provides and ensures is that even during emergencies, we can provide adolescent-friendly services. And MISP has tailored activities specific to sexual reproductive health needs of adolescents, beginning in this chapter 4 and extending through the rest of the toolkit. So MISP is actually more about how to have an adolescent inclusive and friendly method and approach for towards the sexual reproductive health services. So it doesn't address all the needs of adolescents, nor does it provide the guidance on how to do so, but the rest of the toolkit does. So yeah, just MISP is a roadmap for for humanitarians that should prioritize adolescents inclusive methods in the response in the humanitarian response. So I would like to ask you another question about chapter 4. So you had an overall information about chapter 4, and I would like to ask your opinions about why do you think chapter 4 is important um, from your perspective. Can anybody share what makes chapter 4 important for themselves? Yep, we have Dr. Iftiar, our co-facilitator, coming back. Thank you.
Sorry, so sorry, there was a connectivity problem, Omar.
It's okay. It's fully okay. We were discussing why the chapter 4 is important with our participants. So I didn't see any input now, but maybe I should say my view on that. Actually, chapter 4 is providing practical tools and resources on implementation of MISP. MISP, as I told, MISP ensures that even during emergency, we have adolescent-friendly services. So MISP, so in the MISP, we'll be able to form the sexual reproductive health services in an adolescent-friendly way. I believe that that makes chapter 4 different from the rest of the toolkit and important for me. So if you have any input, please write them in the chat box as well. So I told in the first objective of the MISP that it should ensure the health sector works in harmony with each other and with other sectors. So we have a term for that, which is cluster approach. So in the cluster approach, the health sector must work with other sectors to ensure crisis-affected populations receive the sexual reproductive health information and services that they need. The aim of the cluster approach is to strengthen system-wide preparedness and technical capacity to respond to humanitarian emergencies and provide a clear leadership and accountability in the main areas of humanitarian response. At country level, it aims to strengthen partnerships and predictability and accountability of international humanitarian action by improving prioritization and clearly defining the roles and responsibilities of humanitarian organizations with the host country. So in the cluster approach, all the stakeholders such as government, UN agencies, civil society actors, non-governmental organizations work in harmony with distributing the tasks and the roles. For example, early recovery is provided by the UNDP, health is from the WHO, education is from UNICEF, UNHCR ensures protection, FAO for food and food security, and so on. So these entities with the local actors are essential partners for ensuring response interventions to an emergency. So that is called cluster approach. I think I'm done with the chapter 4 now. Now we will go over to chapter 5, which my colleague Amit will be moderating. Over to you, Amit. Amit, you're muted.
Oh yeah, Amit, we can't hear you. Please unmute.
Oh, sorry, like I forgot that I muted myself. Yeah, thank you so much, Omar, for introducing us with chapter 4, and now like we'll proceed with the chapter 5, and which is going beyond the health service. I think it is very important topic for all of us who are at field working for adolescent sexual and reproductive health, and like we already discussed in chapter 4, why we need to focus on adolescent sexual and reproductive health and how And also, like, we also discussed why the SRH need of adolescent are unique. And during our plenary or during the introductory sessions also, like, we discussed how our within this breakout room as well, we discussed how the SRH need of adolescent are very unique. So these unique services, this unique demand, these unique needs of adolescent cannot be fulfilled only by the health services. So there is dire need to move beyond the health services. And this chapter focuses on providing examples of activities that address the individual, interpersonal, community, and structural influences that affects adolescents' ability and decision to seek the use of sexual and reproductive health services in emergency setting. So usually, if you look at this chapter 5, it discusses two big concepts and two like very important concepts. One is holistic lanes, and the holistic lanes here means that the chapter emphasizes that the need of whole person, not just those identified by the health staff themselves, but also the environment around the adolescent that influences, like we discussed, the ability of their decision making and the ability or like the environment that helps them to make an informed choice. So this chapter specifically focuses that we need to see the unique SRH need of adolescent through holistic lanes. And not only this, like the holistic lens also focus by strengthening program linkages. Also, it also provides emphasis on referral pathways, the coordination mechanism, and with help of this, SRH and health managers can definitely addresses the full range of barriers associated with like SRH information and services. So that is why it is really important to go beyond the health services. And you can also see there, if you have already had a chance to see the chapter 5, it also discusses social ecological model, where there are like lots of intersectional factors, such as like we already discussed about like the individual, interpersonal, community, or structural factors that affects their ability. So it is very important that one, we look at the holistic lens, and second, we look at the social ecological model. So and also the chapter 5 also provides us information about it provides the figure where the holistic ASRHR programming along with the social ecological model has been described, where interpersonal relationships such as attitudes, belief, expectations, community factors such as social norms, cultural values and traditions, similarly health service and system, humanitarian coordination and leadership, and economic, political, and security and environment have been well described within this chapter as a part of social and ecological model. Similarly, it also there is also table 4, which helps you as a service provider, or you as a leader, or you as a community volunteers to identify various problems and how can you respond to those problem. So the table 4 also describes that, giving you like the range of the past experiences and also like the response that you can implement in your own community and society. So one of the very important aspect of this chapter is also like building a multi-sectoral linkages and how can we do it. But this is further explained in the chapter 6. But it also like pays very good attention on like how multi-sectoral guidance and activities can help to address the unique needs of the adolescent. I think we have 12 participants here, and I think we have very good experience within our this breakout room as well, who have experience of delivering SRHR services during this humanitarian crisis situation. So I would like to start with Dr. Ikhtiar. Can you please explain like how, why we need to move beyond, or why we need to go beyond health services? And definitely you can talk from your experience from your work or like what you have seen. So I would like to ask Dr. Ikhtiar to provide your input here.
Thank you, Amit. Thank you very much. It's a really good opportunity to share from my experience. Yeah, you rightly pointed out how important to actually go beyond the health services. If you consider the adolescents, if you consider their needs, if you consider their context, if you consider their total arrangements, so it's not only health service can meet their need, because even especially when you talk about the SRA services or even informations, it's very culturally sensitive to our society. So it's not easy to talk first time to on this to need for that, or even from the provider perspective, they are not comfortable to provide this service. Even the teachers who are providing that, who are supposed to provide the information, they are not comfortable to teach these issues. So is considering these things, there are very clearly required a entry point of that getting this. So that entry point actually beyond health services, it can be actually the communications skills, that's very important to actually have that. So then, so that they can rightly communicate to their need, rightly communicate to their requirements. This is important. Second, this it's not easy to adolescent can get the services if they want. Their parents, their relatives, they need to be part of their journey. So they need to be in support for them. So it's also another area. So it's not the health service issue. It's the issue beyond health service. So talking about some of the information they can get from the schools and education systems or education. So even in the emergency system, when they approach to education, that can be the easy way to actually sensitize them. So it's very clearly said that SRA for adolescents has very important role to play with the other factors of beyond health services, and that's actually will make uh, an and suitable environment for them to get the access health services very comfortably and friendly ways. So
Thank you.
I saw that is very rational to look for beyond health services to confirm the SRS for adolescents. Thank you, Amit.
Thank you so much, Dr. Ikhtiar. If anybody wants to provide very short input on like why we need to go beyond the health service, or you can also like provide your input in your chat box as well. And like please provide your input in the chat box. I can see a lot of people here from youth organizations and from like very like other organizations as well here. So if you can provide your input here on the chat, that will be nice. In the meantime, I would like to open the floor for participant to reflect on like how like you plan to use this toolkit in your own work and setting. Please go ahead and you can speak now if you want to. How do you plan to use this overall toolkit in your work?
Maybe I can answer this question.
Yeah, please, Omar, go ahead.
Thank you. Actually, the target group of my organization mostly consisting of youth and adolescent refugees. So therefore, it's described more as a humanitarian emergency. So adolescent sexual reproductive health plays a critical role when it comes to the emergencies. And I believe this toolkit is a great way to prioritize SRH services in my organization.
For breakout session, we need to make our concluding remarks.
Yeah, exactly. We are concluding now. So we to use adolescent inclusive methods and to use holistic programming, just as you and Dr. Ikhtar mentioned, we can really benefit from this toolkit, I believe. And so I think this toolkit also will be very useful in terms of establishing community engagement with different stakeholders, such as community health workers and NGO workers or other community actors as well. So if you, Amit, want to share your experience again for this question, I would love to.
Yeah,
in
I think
60 seconds.
Yeah, like we discussed very good about like why it is important to prioritize adolescent sexual and reproductive health and rights during this crisis situation. And also, like we already discussed, like there are unique needs of adolescent, and that is why to meet them, we need to go beyond health services. And one of the main things that we have to prioritize is like seeing this issue through holistic lens, multi-sectoral coordination, and also like through socio-economical model. So I think that is like very important as well. So yeah, thank you so much everyone for your insights and for your participation. We will see you in the main session. Thank you for your participation.
Thank you, Omar and Amit, for your excellent facilitation.
Thank you.
Excellent.
Thank you.